Would you let a first or second grader or any child use medical marijuana? Some family members in Oregon say yes. 7-year-old Michaela Comstock has an aggressive form of leukemia. Michaela is a registered medical marijuana patient. Her mom gives her the drug every day. Not surprisingly, there are some, including her father, who have concerns about this. I mean, after all, she's 7 years old. Dr. Sanjay Gupta joins us now with more, and we wanted to get your opinion on this.
Well, I mean, the first question a lot of people are going to ask is this even safe to do? And this ends up being the crux of a lot of questions surrounding marijuana. What is hard from a purely scientific standpoint is that it's an illegal drug in the United States, so it's hard to do studies on a drug that's illegal. So you often look to other countries to try and get data. And it's also, and here we're talking about a child, so it even makes it more difficult to do these studies in children. So we don't know a lot about the safety overall. We do know, in Michaela's case, there are 51 other children in Oregon who are also registered to be able to get medical marijuana. So she's not the only one. This is something that the doctors have obviously prescribed for not just her, but other people.
So tell us how marijuana is administered, because it's not like she's sitting down and smoking a joint, right?
Right. Well, there's all sorts of different ways as well. People are used to thinking of it that way, but it also can be in baked goods. It can be in a capsule form where you're actually taking some of the active ingredients. THC is the ingredient people talk about quite a bit. It can give you that feeling of being high, but it can also, it's a very good nausea medication, for example. And this is not anecdotal anymore. This has been proven in studies dating back to the 1970s. So people who are getting chemotherapy, for example, can take this to try and prevent the nausea associated with that.
So in Michaela's case, it did ease her pain, and some have even gone so far, I think she's in remission right now, right?
Right.
So some say that the marijuana helped kind of cure her leukemia. Is that possible?
Well, if you're talking specifically about its effect on the cells, I think that's harder to say. But all the other stuff, I mean, chemo is a very toxic drug, probably a lot more toxic than cannabis is. But all the side effects that you get from that, the marijuana, the pain, as you mentioned, just from the cancer itself, a lot of those types of things can be treated to some extent with the THC, the way that she was getting it. Now, doctors will say, are there other ways to do it that are less toxic, have a higher impact? We don't know. In her case, it seems to work. And as I say, in a lot of other patients who are young, we do know in people who start before the age of 15 and keep doing it throughout their life, even sporadically, tend to have an impact later on in life. They lose about 8 IQ points on average. Again, these are hard studies to come by. That was a study out of the Netherlands. But for adults who do this, at past age 15 or past adolescence, certainly, the long-term impact in terms of safety, there's not a lot really written to say that it's necessarily a problem.
Well, it's easy to sit back and criticize the parents in this case, criticize the mom, but when you have a 7-year-old kid in terrible pain, you want to relieve their pain.
Yeah, and I read the whole article, and I've been following the story. I don't know what the relationship is between the parents and the doctors here. There are clearly doctors in Oregon who think that this is a viable form of treatment. I'm not sure where the communication breakdown here is. There is even FDA-approved versions of this that can be given in adults as well and children. So, there are options for them. They're doing it a little differently. I'm not sure why that is. But as a treatment, though, in adults, I think we're beyond the anecdotal, beyond the sort of, there's actual studies. In children, it's harder to come by. But again, you are getting more and more children part of these registries.